Hi, Sue McCarthy Robinson. This is the journal video for MN662, week 8. We're talking about cognitive behavioral therapy and using it with during one of my encounters. So the CBT employs specific techniques to change thought patterns, consequently behaviors. So one core technique is cognitive restructuring, where individuals identify and challenge negative or irrational thoughts, replacing them with more realistic and balanced ones. Exposure therapy is used for anxiety-related conditions, gradually exposing individuals who fear situations to reduce avoidance behaviors and anxiety responses. So this week, I had a client that suffers social anxiety. So when he enters, especially when he enters an elevator, and goes in public places, there's people around, he just really becomes extremely anxious to the point that he avoids elevators, he avoids going in large groups. So I asked him to imagine getting into the elevator with a group of people. I asked him to share with me how he was feeling at that time. These techniques work together to alter that maladaptive thought patterns, leading to healthier behaviors and improved emotional regulations. He did share with me that he felt anxious, kind of thinking of those things. He said his palms were starting to sweat. So, implementing the CBT in, clinical practice in the future, I wanted to reiterate to him that, imagining that situation, he was fine, he was safe, and just reminding him just to try to reduce his anxiety so that maybe he can go back into the, taking an elevator or going in and being amongst people. So focusing on that restructuring, behavioral activation, problem-solving techniques, utilizing the thought records and activities. I guided, him through identifying and modifying those negative thoughts, patterns, and behaviors. Training in the CBT specific skills and ongoing supervision can enhance my proficiency with it. So using those tools, I can use worksheets, digital apps, to support my patients between sessions, to get some ideas on how to facilitate using this practice. So what are specific diagnoses that can, going into like the dialectical behavior therapy, is used primarily for researching it for the borderline personality disorder, where it addresses emotional dysregulation, impulsivity, and self-harm behaviors. It's also beneficial for individuals with mood disorders such as depression and, bipolar disorder, and for those struggling with substance abuse. So treating eating disorders, you can use that dialectical behavior therapy, particularly with like bulimia, neurosis, binge eating, can help, individuals with post-traumatic stress by enhancing emotional regulation and distress tolerance skills. Overall, the DBT's the purpose is to focus on that mindfulness, the interpersonal effectiveness, emotional regulation, and distress tolerance, which makes it versatile for various mental, health conditions. So in my current clinical encounters, several sessions use the CBT. I utilize techniques to help the patients identify and challenge their negative thought patterns, and behavioral activation to encourage engagement in the positive activities. So thought records have been employed to assist patients in tracking their thoughts, as I did with this one gentleman, his emotions and behaviors, facilitating greater self-awareness and cognitive change. So the technique was proven effective in treating, the conditions as depression, anxiety, and PTSD, helping patients develop healthier thought patterns and behaviors, ultimately leading to improved mental health and well-being. So another question, have your current clinical encounters included any of the sessions with CBT? Of course, I mentioned that it has. These sessions included, cognitive restructuring to help patients challenge and modify those negative thought patterns and behavioral activation to encourage participation in positive and rewarding activities. So thought records were also used to help patients track and analyze their thoughts, emotions, and behavior systematically. So these techniques have been particularly effective in treating patients with depression, anxiety, and PTSD, facilitating significant improvements in their mental health by promoting healthier cognitive patterns and behaviors. Describe the experience with the CBT session. So in the recent, I guided this patient through that cognitive restructuring, helping him identify and challenge those negative thoughts about his self-worth. He says, his self-worth has been reduced because of being embarrassed that he's unable to ride the elevators or go into a group of people. So, I delve a little deeper and asked him, what was his first time that he felt very anxious with the elevator large group? And he said when he was young, he started having seizures, and the first traumatic seizure that he had was right after he went into an elevator. So I'm going to continue working with him that he's attributing that elevator ride. There was people in it. He felt the aura come upon him. And then shortly after exiting that elevator is when he had that first grand mal seizure. So it's, I think, just the trauma of that kind of fueled how his view of becoming anxious, getting on that elevator. So I'm hopeful that we'll continue to use the CBT so that he can foster positive cognitive and behavioral changes with this. Thank you.